Hey, everybody. I'm Dr. Seth, clinical psychologist, Dr. Seth Meyers. Before we begin, I just got to get this question out of the way. Do I think that I got a pretty good haircut this week? I got to say, I think so. And at the same time, whenever I go to get my haircut, I got to say, they're asking me questions. Do you want it this way, that way? And I'm always saying, honestly, I don't really care. Short hair grows back so fast, it doesn't really matter. But anyhow, I digress. Today, I'm going to talk to you about just a couple of things, a couple of reminders that I want to share that can be helpful if you have decided that you want to try to find a therapist. The first reminder has to do with who that therapist is, and the second reminder has to do with how you want the therapist to work with you. And I'll describe a little bit more about that. But before, I actually just want to share a little bit of information in my own experience. My first experience with therapy started, I think I was 24 years old. I was in graduate school on my way to earning my doctorate in clinical psychology. I was in my first year and I was feeling overwhelmed in my life and just having challenges and relationships and other things. And I just knew that it would be helpful for me. And I really was looking for help at how to kind of manage everything better. Well, I did some simple research. This was in New York City, where I went to graduate school. Did a little research and found a place that was great. It was a small center for psychotherapy, and I don't know, maybe 5 or 10 therapists worked out of there. And they offered a sliding scale for young people that really didn't have a lot of money. Back then, I was waiting tables and trying to do the best I could just to kind of keep the bills paid. But, a lot of people will relate when they're really young, they don't have a lot of financial resources. And so I found a place that actually had a sliding scale for therapy, and that can be really helpful. So that's just kind of a little side tip that I can share before we go further. If you don't have insurance, as I didn't have insurance at that time, and you really are limited on financial resources, you can find out whether there are local mental health clinics where they may offer sliding scale therapy, or there are also virtual spaces online where you may be able to do sliding scale therapy as well. But I bring all that up to say that my first experience with therapy was such a positive one. I got so lucky. I got a guy who was maybe 10 years older than I was. We had a similar sense of humor, so we could joke and laugh, and it didn't feel overly intimidating or too heavy for me, even though sometimes, what we would talk about in sessions was heavy. But the personality dynamic between us was very in sync, and that was really, really helpful for me because of that. And I was lucky. I was lucky. The first therapist that I ever got assigned to. But what I want to share in this video is that rather than depend on just luck, I think it's really helpful for people when they decide to seek out therapy to keep two different things in mind. Now, let's talk about the first one, who the therapist is. For some people, it's really important that they have certain things in common with their therapist. Maybe they would like ideally to have a therapist of a certain ethnicity or a certain cultural background, who maybe speaks a certain language, who is well versed in working with people of a particular sexual orientation or gender identity. Some people want a therapist who is in a similar age range. So these are all sort of like demographic factors, right? Well, to some people, it's really important to them. If some of those variables are important to you, assert that when you go to look for a therapist. And you can always feel free to ask questions. Now, the therapist in the beginning may say that they don't want to share certain information, and that is certainly their right, but it's also your right to ask if it's important to you. Also, a lot of therapists will share in different directories about different groups of people that they specialize in working with, so you know from the beginning. But consider that who the therapist is as a person and who you are as a person. You really want there to be a good, comfortable fit so that you can do this therapeutic work together. In addition, the second reminder that I want to talk about is how you want that therapist to work with you. There are therapists that operate from all different types of therapeutic modalities, and you can talk and you can ask your therapist how they work. What is their approach? You can also think about things like this. Do you want a therapist who really, in the beginning, just listens a lot? Or do you prefer that the therapist ask you a lot of questions? Do you want the therapist to talk a lot, to share their interpretations a lot, to give you specific advice? These are all things that you can think about. So when you are looking for a therapist, remember to ask yourself how you want them to work with you. In a therapist-client relationship, you are the customer, and what you want and how you want to work is important. So make sure to share from the beginning what you're looking for, and then throughout the therapeutic process, you can also fine-tune it and let them know how you're feeling about certain practices as they're unfolding. Well, I hope this video has been helpful to you. If you like this video, you can also check out my whole library of videos on my YouTube channel here. I also have a podcast, Insight with Dr. Seth, where I talk about hot topics, the things that matter most to you. We talk about narcissism and codependence and personality challenges. I also conduct interviews with experts and everyday people on a whole range of topics on human nature so that we gain insight into ourselves and others. Well, I hope you all have a good rest of the day. Take care.